Prediction model for diabetes in adults. Screening for diabetes risk factors. Abnormal blood glucose is one of the risk factors for cardiovascular disease, among hypertension, dyslipidemia, smoking, obesity, and sedentary lifestyle. According to the U.S. Center for Disease Control, the prevalence of diabetes is approximately 1 to 10. Previous study using informatics methods to extract information from electronic health records found that 30.6% of the patient were not screened for diabetes, despite a known diagnosis. The purpose of this report is to explore a prediction model for diabetes using information from electronic health records. Records were extracted from existing database. Age range was narrowed to include patients between 44 and 99. Diagnoses were identified according to ICD-9 standard code. No repeated diagnoses was allowed. Diabetes, also known as diabetes mellitus, is defined as long-term metabolic disorder characterized by high blood sugar, insulin resistance, and relative lack of insulin. Complications of diabetes include heart disease, stroke, blindness, kidney failure, limb amputation due to restricted blood flow. 80% of the source data was randomly chosen. Likelihood ratio was calculated for diagnosis with more than 29 observations. Only first occurrences of diagnosis were included. A total of 3,013 unique diagnoses were analyzed. Likelihood ratio for distinct age group based on a 12 months calendar from ages of 14 and 99 and likelihood ratio based on patient's sex were estimated as well. The top 10 predictors of diabetes are either directly or indirectly related to diabetes. The most predictive diagnosis was polyneuropathy in diabetes. This type of diagnosis is considered to be an obvious predictor, as its diagnosis code directly relates it to diabetes. Other obvious predictors include long-term use of insulin, background in diabetic retinopathy, insulin and anti-diabetic agents causing adverse effects in therapeutic use. In obvious predictors, the predictor are usually a prognosis or a complication of the primary disease. Important predictors are diagnoses that were strongly associated with diabetes, but based on their diagnostic code, it cannot be concluded that they are a subset of the primary disease. An important predictor can be a standalone underlying condition or appear in a combination with other risk factors. In this table, number 3, 6, and 8 are known complications of diabetes. However, the diagnostic code does not directly tie them to diabetes. Rare predictors are predictors that almost never associate with the primary disease. Rare predictors are an important part of the predictive models as they help understand etiology and further evaluations of the data subset. In this slide, we see the top 9 rare predictors that were found in this analysis. In this predictive model, naive Bayes was used to aggregate data from individual diagnoses to overall risk of diabetes. The product of diagnosis, age, and sex according to patient's medical history was used to derive patient's predicted score. To demonstrate how predicted probability was calculated, let us look at patient 352. For the purpose of illustration, we'll call him Joe. Joe is a male with 5 different diagnoses, all diagnosed at the age of 82. Diabetes likelihood ratio of each category was pre-calculated and stored in the database using 80% of the data source. According to naive Bayes formula, the product of likelihood ratio determines the odds of the outcome. In this case, we have 5 likelihood ratio for diagnosis, 1 likelihood ratio for age, as all were diagnosed at the same age, and 1 likelihood ratio for male, as he was male the whole time. Multiplying all of this together would give the overall odds for diabetes and predicted probability. The score for this patient is 0.15, which is very low probability. And indeed, Joe does not have diabetes. The prediction model was validated on 20% of the data using random sample. Receiving operating curve was plotted to evaluate the accuracy of the model. What we see here that the model is the most sensitive when predicted probability is at 0.72. The overall area of receiving operating curve was determined at 0.88. In this presentation, we showed how diabetes can be predicted from electronic health records. Electronic health records allow us the use of large samples and patients' information. This can help decision support systems at various levels of medical settings for various diagnoses and medical events.